First, thank you very much for the opportunity to be with you and speak about a project that I did during my PhD doctoral school time, but which wasn't a part of my PhD, in fact, but was connected with the COVID pandemic, which was happening during that time. My name is Iwona Nowakowska. I'm a PhD in psychology since 1 year. Now I'm working at Maria Grzegorzewska University in Warsaw, which is a part of the Enter Mental Health Network. And currently I am a postdoctoral research fellow at Università Cattolica del Sacro Cuore in Brescia, Italy. And I'm speaking to you from Italy. The co-authors of the study are Milena Markiewicz, Daniel Pankowski, Kinga Wytrychiewicz-Pankowska, Anna Banasiak, and Ewa Pisula. To start, I decided to research the topic of resilience and of job burnout in school teachers, and also taking into account the level of depressive symptoms that was displayed by the teachers. The COVID pandemic was a difficult time for all of us. There were many research regarding the problems, the mental health problems in the general population, but also in specific professions, and teachers were quite affected by the pandemic. In Poland, there was great pressure on the Polish school teachers because they had a variety of modes of working. It was very dynamic. Once they were asked to work on site, once to have it remotely, once hybrid. And the schools were not well prepared to act accordingly to such dynamic changes. There was also lack of generalized information how to organize these educational processes, and often teachers were left alone in deciding how to navigate during these difficult times. And with my research team, we decided to, building on the job demands resources theory, to examine what were the correlates and the mechanisms which were responsible for job burnout in teachers. The job demands resources theory, which was the basis of our research, is generally a seminal concept of job burnout. And it assumes that there are job-specific factors, which are job demands and job resources, and they affect the well-being of an employee. This theory is applied in many contexts and in many professions, including the teaching profession. And it conceptualizes job burnout as a consequence of excessive demands. So what we are expecting from, for example, teachers, on an employee who doesn't have sufficient resources to cope. And in a minute, I will show how COVID and the circumstances that were connected to COVID may have contributed to this depletion of resources. But generally speaking, there are two processes of job burnout according to the theory. First, if there's a long-term overload of demands, so we expect very much from our employees, it may lead to exhaustion. But on the other hand, there may also occur another mechanism that you have lack of resources, and then there is a difficulty coping with the professional demands, which may be normal and the demands that we are used to, but we don't have resources to cope with it successfully. This leads to withdrawal from the activities at work, and that leads to lack of commitment. And COVID was bearing a great risk of job burnout in school teachers, not only, but this was the focus of our study. First, the environment was unpredictable. So teachers didn't know what to expect in terms of the demands. They were also not knowing when they will, for example, get infected with COVID, whether their students will or won't get infected, and so on. And next, work overload. The necessity to be very flexible in terms of how to perform work, what kind of materials to prepare. This was new and unexpected. Increase in job demands from the school principals, from the ministry, from the general expectations, for example, from parents. And next, the blurring of the line between work and personal life. Of course, it occurred in many professions, and it was connected with the fact that teachers needed to stay at home, some of them at least, in order to perform work. And it was quite difficult for them to remain within the personal life or within the work life. It was blurred and it was mixed. It was difficult to be out of work. And finally, the risks connected to the disease own regarding the family, the friends, the students and their families. All of this may have brought anxiety and lead to the depletion of resources, the personal resources to cope. And one of the most important personal resources in coping is the resilience. And it's the ability to bounce back from adversities. And it's in literature, it's found as a protective factor against job burnout. However, it might have been challenged during the COVID pandemic due to the numerous changes to the people's lives, the necessity to adapt to them, also the loneliness and shifts in the patterns of home and work life. A high level of resilience in employees is generally related to lower severity of burnout symptoms, and it's confirmed in many studies from around the world. And what about depressive symptoms? As we heard, job burnout may lead to exhaustion and to lack of resources. And some people argued that job burnout has many common characteristics with depressive symptoms, such as loss of energy, feeling of impaired concentration, feeling of worthlessness, problems with appetite or sleep. However, many studies have shown that these constructs are not the same. They are distinct and robust, but still we will find high correlations between them. And we found that we should control for these depressive symptoms and maybe think about how they can moderate the relationship between resilience and job burnout. This relationship between burnout and depressive symptoms can also be of two kinds. So burnout can lead to an increased allocation of resources to deal with job demands. Then these resources are depleted, and then there's a decreased chance to allocate these resources to other life areas. So if I depleted my resources to job, I can't cope effectively in, for example, my personal life too. And that leads to general depressive symptoms. On the other hand, depressive symptoms are connected to a negative outlook on life and a decrease in the individual psychological resources in general, which may also lead to poorer performance in various contexts, including work. So that resembles job burnout. In our project, we wanted to disentangle the relationship between resilience and job burnout, and we checked how it differed across levels of depressive symptomatology. Our first hypothesis was quite simple, and it was about the association between resilience and job burnout, and we hypothesized on the basis of a vast amount of literature that is negatively linked to job burnout in teachers. So the higher the resilience, the lower the job burnout. However, we also hypothesized and found evidence in literature that people on depressive symptoms perceive that they have more challenges with handling stress, and they are more vulnerable and hostile in response to adverse events in general. So we supposed that the capacity to bounce back from adversities, so using resilience, couldn't have been enough for teachers with high depressive symptoms to be protected from this job burnout. That's why we tested a moderation hypothesis that the higher the level of depressive symptoms of teachers, the weaker the linkage between resilience and job burnout. We conducted 3 studies, which were like self-replications. The first one was during the so-called second wave of the pandemic. It was a period when the vaccinations against COVID were just introduced to Poland, but were unavailable to teachers. It was December, January 2021. Study 2 was the so-called third wave of the pandemic. It was 2 weeks after the teachers were allowed to take this vaccination. And study 3 was during the last month of the school year. And there was a significant decrease in the COVID infection rates in Poland. It was June and July 2021. As you can see, we had quite large samples. In study 1, 1,006 school teachers. In study 2, 1,689 school teachers. And study 3, 625 school teachers. These were not the same teachers, so we didn't manage to make it longitudinally. These were 3 cross-sectional studies. The majority of these teachers were primary school teachers. The procedure was the same for all these 3 studies. They were anonymous, voluntary online surveys. We recruited the teachers through emails. We sent them to schools and also approached teachers in Facebook groups related to education and teaching. Of course, all participants provided informed consent, and our procedure and materials were approved by the Institutional Research Ethics Committee at the University of Warsaw Faculty of Psychology. The measures that we used were brief resilience scale for measuring resilience. It is a very robust and very good measure, one of the leading measures of resilience. Also, to check job burnout, we used the Oldenburg burnout inventory. It consists of 2 subscales, but we use the generalized index. For depressive symptoms, patient health questionnaire, and we got very good reliabilities of all these measures, over 88 Cronbach's alphas for all scales across studies. How about the results? We generally confirmed the first hypothesis, so resilience was negatively related to job burnout across all 3 studies. Also, the depressive symptoms in its simple effect was very highly related to job burnout. And we also found a moderation effect. Interestingly, I will also tell that gender was significant in terms of study 1 and study 2 with males, with men having greater propensity to have job burnout symptoms, but it was quite a weak effect. And job seniority didn't matter across studies. It was an interesting thing that it didn't matter how long you were in this profession for job burnout. And this moderation effect, resilience and depressive symptoms, was significant in all 3 studies, and I will show how. In study 1, we found that on all levels of depressive symptoms, so high, average, and low, resilience was negatively related to job burnout, and the effect was more robust the lower the level of depressive symptoms. You can see it on the chart. So you can see that the highest line is about the highest level of depressive symptoms. So generally, these people have higher burnout. But the effect of resilience is, the protective effect of resilience is the weakest. It is the most steep line is for the low level of depressive symptoms, and that means that resilience plays a protective role in this case mostly. In study 2 and 3, the pattern was similar with this exception that on the high level of depressive symptoms, this relationship between resilience and job burnout was non-significant. So people are depressed, and regardless of their level of resilience, they have the greatest propensity to have the job burnout symptoms. And for last remarks, the discussion about hypothesis 1, so about this linkage between resilience and job burnout. This negative relationship has been confirmed in our study. It is in line with literature about resilience as a crucial protective factor against professional burnout. However, we need to take into account that all these results are cross-sectional, so we don't see how these job burnout symptoms are developing. And we don't know if resilience acts really protectively, or if job burnout is a factor that weakens resilience. And this should be disentangled in longitudinal studies. And for hypothesis 2, regarding the moderating effect, it also has been confirmed. Again, people with high depressive symptoms may have difficulties using their resources to cope. For example, due to the cognitive distortions they have, like black and white vision, the depletion of motivation, which diminish resilience. However, again, we need broader analysis to identify the various components of resilience and to assess their importance for coping flexibility, and also specific beliefs that may promote job burnout. It also should be noted that resilience is relatively constant disposition of an individual. It can be strengthened by some interventions, also psychotherapy, but not only. Working on resilience can also help in diminishing the negative symptoms, like depressive symptoms and like job burnout. We also should pay attention to the situational context of the period in which the data was collected, because, as I said at the beginning, the COVID pandemic was a situation, a large and a strong social situation that affected how people were coping with stress and how many stressors they were encountering. So that's why we need to pay attention when interpreting that this may not replicate now, but may have applied to this specific time. And final conclusions. Schools and networks of educators should pay attention generally to the mental health to eliminate the potential sources of job burnout. And this is not only about the personal factors, but also about the situational and contextual factors that relate to the schools. So, for example, work division offering self-development programs could enhance resilience in teachers and prevent these negative symptoms, which may lead to withdrawal from work. Helping teachers effectively organize their work can also be helpful, for example, by eliminating uncertainty, gaining new skills which are necessary to act flexibly and to navigate in the online world of modern education. Also raising awareness about mental health, which is very, I would say, relevant to the network in which I'm speaking now. This may be necessary to be able to capture the early onset of depressive symptoms and also of job burnout, and to be ready to help not only oneself, but also colleagues, and help strengthen oneself and prevent the adverse consequences of job burnout. The network of social support, the family, friends, but also colleagues, and the members of the school staff seems to be crucial, as the social support system is the first frontier of providing this first psychological aid, emotional and instrumental. Thank you very much, and I'm open to questions.